Hi, today I'll be talking about a very common clinical condition that we see as dermatologists in our practice, that is chronic urticaria. We all know that allergic diseases are extremely common in the general population, and amongst these urticaria, and specifically chronic spontaneous urticaria, is likely to affect up to 20% of our patients throughout their lifetime. It's often associated with wheal and flare type reactions, and it can be associated with significant morbidity including itching, pain and discomfort in our patients. The factors triggering the onset of urticaria are not really clear in most of the patients, and almost 50 to 80% of patients across studies have been known to have no identifiable factor, and so it is called idiopathic urticaria. Through this understanding, of course, the option is, if we can find an identifiable cause, to avoid it. But in all other cases, we have to give standard non-sedating antihistamines to our patients to target the allergic pathophysiology of the urticaria. While all international guidelines, they recommend that non-sedating second generation antihistamines should be the ones for the treatment of urticaria, it is sometimes difficult to select the ideal drug to treat these patients, because some of these, they lack the efficacy, and some others, they cause a certain amount of sedation, some of them cause severe sedation, so that we have difficulty in managing these patients. Today I want to talk about a drug called bilastine, which is a new second generation H1 antihistamine, which has a lot of characteristics which make it quite close to an ideal antihistamine, and it has recently been launched in India. Now, bilastine has been launched already in more than 100 countries globally, and it has a decentralized approval in 28 European countries as well. And extensive studies are there which document its safety and efficacy in more than 5,000 individuals, and in more than 22 million patients have been prescribed bilastine in all the countries that it has been approved so far. So bilastine also is considered the first antihistamine of choice amongst the Asia Pacific physicians, APAC physicians, and ARIA recommends bilastine as the antihistamine of choice amongst all second generation antihistamines, because it is the only one to achieve a perfect 10 in their antihistamine scorecard. In India, it has recently been approved for the symptomatic treatment of allergic rhinitis and chronic urticaria for patients more than 12 years of age. Bilastine 20 milligrams comes in an OD dosage, which is effective in managing the symptoms. It has a quick onset of action and has a long duration of action than fexofenadine also. The duration of action is slightly longer, and so it's a potentially attractive therapeutic option in this scenario. Its effect versus levocetrazine are backed by various studies which state its superiority compared to levocetrazine in terms of symptom-free patients, response rates and health-related quality of life issues of vis-a-vis these two antihistamines. When it comes to efficacy, bilastine has very high affinity for H1 receptors, 3 to 6 times higher than cetirizine and fexofenadine respectively. It has rapid and sustained action, with an 8-hour duration of maximum effect and significant activity for at least 24 hours following a single dose. And this makes it nearly an ideal choice amongst the modern second generation antihistamines that are available. So it's also ideal for updosing, because as we know, according to the IACI, Galen, EDF, WAO guidelines for the management of urticaria, it is recommended that antihistamines should be doubled or quadrupled in their dose if they are not effective at the usual doses. Now, with that in mind, it's interesting to know that bilastine has a Tmax of 1.13 hours and the absolute bioavailability is close to 61%. Its half-life is estimated to be about 14.5 hours, while the published values for cetirizine, levocetirizine is between 8 to 10 hours. So it scores a little bit over levocetirizine in that sense as well. The APAC review on the selection of optimal second generation antihistamine for urticaria has also given its support to bilastine's safety. Now, the robust clinical assays of bilastine in studies in healthy volunteers and actual accumulated clinical experience of over 20 million patients, it has shown a profile of adverse events which is very similar to that of placebo. So practically no very significant adverse events have been seen, and it does not seem to affect the cardiac conduction, alertness or driving ability even in doses of up to 40 milligrams a day. Bilastine also does not prolong the QT interval, which is a significant cause of concern in certain older antihistamines. And also, in therapeutic doses, it does nothing to the cardiac conduction, which is a very attractive quality in an antihistamine. And if you look at the pharmacokinetics, then it does not have any CYP450 mediated interactions, so it's good for patients who are on polypharmacotherapy, etc. And it is also not necessary to make any dose adjustments in patients who have a compromised renal function as well, or in patients who are over 65 years of age, or in patients who have a hepatic impairment. It has a very low potential for CNS impairment, as has been seen in clinical experience, even when it is co-administered with alcohol or other CNS depressant drugs. At therapeutic doses, bilastine does not have anticholinergic effects, so the dry mouth and other irritating effects that can affect the psychomotor performance as well are not there, and it is a good substrate for P-glycoprotein, which would limit its passage across the blood-brain barrier and thereby minimize the chances of any CNS side effects of this drug. As it shows relatively zero-order brain H1 receptor occupancy compared to others, the incidence of sedation with bilastine is almost the same as placebo. So it doesn't have any effect on driving ability or the ability to even drive almost like a F1 Formula car or even aircraft. So there are several on-road driving tests that have been done, and bilastine has not shown any significant differences from placebo in terms of the alertness of the participants or their ability to perform these complex motor tasks. Even when it is tested in simulated high-speed driving of an F1 car-like scenarios, operating heavy machinery or in pilots operating airplane, bilastine did not induce any significant sedative effects. So, there was a study in which it compared an active control arm which had hydroxyzine and standard dose bilastine 20 mg once a day, and it found that even higher dose bilastine up to 40 or 80 mg also had no significant effect on any objective measures of psychomotor and driving ability in these patients. So as a clinician, all this information it seems quite attractive, and bilastine seems to check most of the boxes for the qualities needed for a good antihistamine to control urticaria. So bilastine has been acknowledged for use by guidelines such as ARIA and as the only one to achieve a perfect 10 score in the antihistamine scorecard, and also has been scrutinized to become the first choice antihistamine for the Asia Pacific physicians.